Hey folks, Dr. Delaney here from Elysium Medical Arts. Just wanted to talk about GLP-1 agonists, commonly known as Ozempic or Mounjaro. And today we're going to debunk 3 myths related to those medications. The first myth that has been going around social media is Ozempic or is semaglutide a crash diet. These medications are not to be used for crash diet. Optimally, we want to use medications to improve your health. As a physician, I understand many people want to just lose weight and look better, and that's all good and fine. But in reality, the larger context of what you're attempting to do is you're trying to improve your health. Therefore, no crash diets are healthy for you. Ozempic can help you, or semaglutide can help you lose weight from a healthy perspective, approximately 1 to 2 pounds a week. Once you reach your target weight, then you can determine what you want to do with the medication. Typically, I tell patients to adapt the medication to their lifestyle. Myth number 2 is once somebody begins semaglutide or Ozempic, do they have to stay on it forever? Typically, no. If you change your behavior, you eat better, you exercise, you don't have to stay on it forever. However, on the other side of the coin, looking at it positively and beneficially, there's a lot of data coming out, a lot of information coming out now that semaglutide is potentially an anti-aging medication to some degree, and it reduces inflammation. So some folks can actually decide to use it to actually improve their health. Microdose it, small doses. The other option, or the other point I want to make is there have been a number of studies that have come out, specifically one I am thinking about right now. Semaglutide, when used for 3 years in obese men, my age, middle age, 50s to 60s, reduced their risk of cardiovascular event, heart attack, by 20%. That's a beneficial thing about this medication. There's other papers that show there's reduced risk for chronic kidney disease, congestive heart failure, and potentially reduced risk for dementia. So while it is a medication, it shows much positive potential for future use. Okay, myth number 3 is the concept or idea that if you take semaglutide, you're going to be sick all the time. For example, some people experience nausea, maybe some emesis or vomiting. Some people experience constipation. Some of our patients very rarely may feel a little fatigued or a little tired, possibly a headache. These tend to reduce with time as patients continue to take the medication. The vast majority of our patients tolerate the medicine extremely well as they lose a significant amount of weight, and they're very happy about that. So the best way that you can manage your side effects, risks, and improve your health is actually see a doctor that's qualified to dispense this medication. I'm a medical doctor. I'm board certified in family medicine, obesity medicine, and anti-aging medicine. All of our patients have done extremely well in this medication. Okay, bonus myth. This is the myth that you didn't ask for, but you're going to get today. Many people have heard about Ozempic butt, Ozempic face, there's even Ozempic finger. What those relate to is essentially people losing tissue, specifically muscle mass and fat, too quickly. The recommended amount of weight to lose typically is about 1 pound to 2 pounds a week. If one loses weight more quickly than that, you will go into what doctors call catabolism, where you're actually not only burning fat mass, but you're starting to burn muscle mass. That is not a good thing, especially for folks that are past middle age. You significantly want to hold on and maintain your muscle mass. So how do you do that if you're on semaglutide? The best way to do it is to do resistance training, specifically exercises with weights, specifically exercising large muscle groups. So that concludes our myth busting event here. We'd love to see you in the office. Please feel free to reach out, click on the links below. It has all our information, and safe journeys. Information provided is for educational uses only. Thank you.